So our ratio that we use is at least 1-to-1. So you need to have at least as much root as you have tooth to do a dental crown. We can do procedures to help increase that ratio. So say if you have a very short tooth on top and then a very long root, then we can use some of the root by doing root or crown lengthening to actually get more height for the actual crown. But ideally, we want at least 1-to-1 ratio because we want the top not to be top heavy where your actual roots can't support it, but we want enough tooth structure to be able to support the actual roots on the bottom. To prepare a damaged tooth for a crown, we will do what we call a buildup. So we will add all the necessary pieces to it, and it's just a simple filling, really. So adding filling material to all the little dips, dents, all the broken parts, and then being able to cut that tooth down. That way you have like a nice cylinder, if anything, not quite perpendicular, but just a hair. That way it looks like a little pyramid that's wider on the top. That way, whenever the crown does go in, it slides right on in, and then you're able to use a lot of like that tooth structure that's there for retention for that crown. There are different types of crowns depending on remaining tooth structure. So if you do not have a lot of tooth structure and we still need space to actually build a crown, then we could do something with a gold crown. So a gold crown is probably the thinnest crown that you can have and the strongest crown that you can have. Only reason it's not really preferred is because it's gold, but it requires a very minimal tooth reduction. So say if you're already at like a short tooth and then we still need to cut down a little bit more to actually make space, then we may recommend an actual gold crown. We do use Zirconia crowns here, so it requires just a hair bit more of tooth reduction, but at the same time, we are able to color it the same as your other teeth. That way it looks natural in your mouth. So yeah, it really depends. So how much space you have left, and then how close we are, getting whenever we are cutting that tooth onto the nerve.